Hello, good morning everyone. Today we are going to discuss about the administration of the medication, and it is a very important topic and very important topic for the exam point of view also. So let's start. Some basic things are there. In the administration of medication, you have to know the routes. Roots are important, then principles are important, nursing responsibilities are important, and storage is important. Nothing else in this chapter. So roots: buccal, antral, inhalable, in infused, IM, intramuscular, intraosseous, nasal, ophthalmic, otic, rectal, subcutaneous, sublingual, and topical, transdermal, and intrathecal. These are the routes of administration of the drug. And if you want a good marks, you have to write the examples also. Means through the buccal cavity, if the question came through the buccal cavity, we should give the oral drugs. For example, the name of the drug you have to written. So examples are important. Then principles of medication, very important. And principles of medication and nursing responsibilities are the same things. So let's start. 5 are important: right to patient, drug, time, dose, and route. But recently it's 7, 10 also, but 7: right reason, right documentation. And if I tell you the 10 5 R's that are: right to patient, right to drug, time, dose, route, reason, documentation, then response. It's also response, then expiry date. Label should be checked before given the medication. Cross checking with doctor prescription is very important. Very 3 times you check the medication. Color important, consistency, and give the information to the patient before administration of medication. Tell the patient about the name of medication, purpose, and the side effects of medication. Then the frequency and duration of the medication. Right to response is also included. For example, if after administration of medication, you should have to see the response of the patient after 10 minutes, after 15 minutes. Then check the history and any allergy, hypersensitivity allergy, and check the mouth of the patient after giving the medicine. It is very important in the psychological patient because they don't chew the medication, and you have to check the site of drug administration. In the case of IV, wear the gloves. It's very important for our safety. So then check the color of the fluid, the color of the medication, especially in syrups. Then check the note on the IV set before the administration, and check the flow rate. You have to know on which flow rate you should have to give the medication in the case of IV. Then discharge of medication should be proper. Harmful drugs kept aside, and ampoules and vials should be broken properly. And labeling is very important. And in the last, recording and reporting. You should have to record after the administration of medication. In the recording, you should have to put the time, the signature, and any allergic reaction if occur. Then the storage. The storage is very important. Safe place. Labeling. Every drug, every section of the drug should be labeled. Then harmful drugs should be kept separate. Syrups should be kept separate. Then all the medications should be kept out of the range of the patient. then in the separate cupboard. Then medical fridge should be lockable, and hygiene and clean place. Avoid extreme temperature. Medication cabinets clean regularly. Then unwanted and unused medications dispose immediately. Don't keep these medications with the fresh medications. Then clear and accurate record. The recording is very, very important. It is the last step. Then these are some questions and which are very, very important. So beside these, you don't need to learn about other questions. It's enough from the exam point of view. Thank you and have a nice day.